when is the typical time frame that you would supplement with estrogen? Ange, I know you guys deal with this all the time, every day. So, what's your thoughts on this?
Yeah. Okay. So time frame, is this like age? Are we talking about age? Is what I'm assuming
Mhm.
with time frame. So that's an
Let
interesting.
me give context here because there is a follow up that might help you
Oh,
with. Is it better to wait until you're not producing estrogen, or should you begin supplementing before to prevent things associated with menopause?
okay. This is a great question. To be or not to be, that is the question. When should we supplement with estrogen? When do we add it in? I would say the short answer, if you just want the short, and then I'll give kind of the educational piece of it, is I would wait until you're in full blown menopause. It's typically when we try. We try to wait till the tail end, not to make women suffer, of course, but adding estrogen during perimenopause when estrogen is very volatile, you can add estrogen on top of estrogen, and then you have a lot more estrogen than you need. So progesterone's a lot more for forgiving hormone. It's more of a buffer. You can add that in earlier. So typically the trajectory of adding in hormones is testosterone for females is testosterone's first. The suboptimal testosterone diagnosis, which isn't an ICD-10 code or a technical diagnosis. It's more of an integrative or holistic look that the T can be supplemented first. Then you add in the progesterone you can add in progesterone during PMS or PMDD. These are different ailments that happen with the menstrual cycle of just an abnormal or a heavy or an irritable or a painful cycle. You can add progesterone in to help out with that portion. So progesterone's second. It's also added in during perimenopause when there's irregular cycles and you start to have some of the first symptoms and onset of menopausal symptoms, which is hot flash, night sweats, and vaginal dryness. Progesterone can help buffer that. Then it's like, do you wait until you stop producing estrogen? We try to, but sometimes it's hard. The technical definition of menopause is a year without a menstrual cycle and high FSH, follicle stimulating hormone. It's your brain talking to the ovaries saying, make more estrogen, which is the primary target organ, ovaries, make more estrogen. The ovaries are like, we're done, okay? I'm out, okay? It's been 10 months. I don't want to make anymore. So FSH goes up to say, make more, make more. And if it doesn't and it stops, that is menopause into postmenopause. And we can safely, or I would say more effectively, add in estrogen then.